I wasn't sure where my career interests would fall in healthcare, but I knew that I was in the right college to sort that out and see what's out there, and it's been such a good experience. I think what makes it unique is we get that interprofessional environment in our first few years of classes, like you're in classes with other Bouve majors, and you kind of see what specifically they're studying versus what you're studying, and sort out where you want to be within the college. I've been really lucky to do a lot of research here at Northeastern, and my first opportunity was through Bouve. It was sort of a grassroots group of students. We were evaluating the non-smoking policy and how that was affecting campus. Like, it was a longitudinal study and where people were smoking after the implementation of the policy. And it was outlined by some Northeastern professors, but executed by the students through Bouve. And those students ended up formalizing into a club at the end of that study, and I'm still in that club. I joined the project freshman year, I'm still in the club as a fifth-year senior. And the research I've done has just taught me to be curious about the world around me and how I can impact my campus community. After my freshman year, I was really interested in environmental health, and I wasn't entirely sure where that was going to take me, but I did a College of Engineering dialogue on climate change, science and policy in India. So I went to 10 cities in India and did something completely outside of my discipline. I worked with students from all different majors, all different colleges. A lot of engineers, but there are political science majors, and me a health science major, lots of bio majors, and we were able to do really interesting final group projects. So I got to take some of the engineering, some of the coding knowledge, and I did a project on how smog in Indian cities could affect cardiac health going forward. And it was so my niche, and I loved it. I think my favorite thing is how close-knit it is, supportive, and I think sometimes you're in a college where the goal is to prepare us to take care of other people and to think about, other people than ourselves to be good healthcare professionals. That reflects back in the interior culture. They want to take care of you and even your peers. We want to be there for each other, and so it forms this really great support system. Through co-op, I did cement my career goals. It's taught me professionalism and to be a member of a team, and it's definitely given me a look at being a real working adult. I like being a student, but we'll see. No, but it makes you excited for what's going forward and the growth that's ahead of you. It's such a good chance to look at different career paths within healthcare, and they talk a lot about how it is flexible, although they give you a lot of support. They're not just letting you out there. So I saw this really unique chance to take classes I liked, and also to see what else I might like that I didn't know yet, and that was definitely why I chose Bouve. I've gotten the chance to work in 2 different fields, and I've gotten the chance to study abroad twice, so I've seen a lot and had this widening perspective, and I think I'm ready to be a really good team member. That's a lot of what I've learned in my classes and in my extracurricular activities, is I'm ready to go out there and work hard and be a good member of a team.